A very good evening to you and welcome to Rwanda Television News with me, Sam Kalisa. The tremors that have been rocking Rwanda district for the past few days began to subside, prompting some of the Congolese nationals who have fled into Rwanda to also begin returning home. Serge Ntore kickstarts tonight's bulletin with this report.
Up to 13,000 Congolese nationals crossed into Rwanda from Goma town, with some going to refugee camps, others finding lodging in Gisenyi's hotels, and others deciding to go to Kigali and then fly to Kinshasa. 241 of the 600 who spent the night in the Umuganda Stadium decided to return home on Friday after the tremors seemed to subside, and because many included nursing mothers, they were given food and snacks to help them along the way.
We are fine, but we have decided to return to Congo. Ever since we arrived here yesterday, we have not heard anything unusual happening back home, which is why we want to go back.
We want to go back because from what we have heard, not many areas were affected by the eruptions and everybody is fine back home. Those who asked to return to the DRC were transported to the border in RDF trucks and other types of vehicles, accompanied by officials.
They had fled because of rumors that it seems did not pan out as expected, and so they wanted to go back home because after all, no place is better than home.
Those who have chosen to stay at the Rugerero camp are being cared for, and despite the tremors appearing to have subsided, Gisenyi town still has not returned to its bustling self.
We slept well last night and did not feel a single tremor. The last few nights have been particularly difficult, with people scared and sleeping outside because buildings were shaking so much they looked like they might collapse at any time.
Some people fled, and those who stayed are struggling to get even the most basic necessities, with markets, banks and government institutions still closed.
It's obvious that the tremors have subsided, and instead of leaving these market vendors to continue selling their produce on the road like this, causing jams, they should just open up the markets and allow them to operate again.
Government officials say certain things must be done before the town's buildings are deemed safe for use.
We have teams inspecting each building one at a time, business to business, because we don't want structures to begin collapsing on people, in addition to the injuries that were sustained during the tremors. The inspections began yesterday, and we hope they will be done this evening so that we can decide which buildings are safe for commercial activities to resume.
Roads damaged during the quakes are also being repaired in the town.
Thank you, Serge, for that report. Now, this Friday, the Ministry of Health has dispatched 247,000 COVID-19 vaccines across remote areas in the country. This follows the country's second dose vaccination program that will take effect this Saturday, 29th May 2021, to cater for those who received the first AstraZeneca vaccine. Gabi Muvunyi reports.
Rwanda has received a consignment of 247,000 doses of AstraZeneca through the COVAX initiative. This Friday, the vaccines have been deployed to hospitals across the country ahead of the nationwide vaccination program set to begin on Saturday, 29th May 2021. Some of the recipients of the first dose say despite the delay on receiving the second dose, they are happy that the time to receive the second dose is here, and that they hope that receiving the second dose will strengthen the immune system. We are happy that we received the first dose, and now we are even happier that the second dose is here.
They told us we would receive our second dose after 4 weeks, but it went beyond that. We are happy that after taking this second dose, it will strengthen our immune system.
As part of the distribution process, the Rwandan Air Force deployed the vaccines to remote areas in the country, delivering them to district hospitals. Some hospital and district officials say they are ready to administer the second dose to those that received the first AstraZeneca dose.
We have received the same number of doses like the last time, and we administered them all. The health workers here at the hospital are ready to start administering the doses.
kubera yuko abaturage bazazihabwa batangiye kubibwirwa.
Tumaze kwakira inkingo ibihumbi 10.
We've received 10,000 vaccines. This is the same number we received the last time as well. They are currently at the hospitals and will be distributed to district clinics in due time.
Ikindi cya kabiri nuko amalista y'abakingirwa arahari.
The vaccination program will begin tomorrow and on Sunday. In these 2 days, we hope to vaccinate all those that received the first AstraZeneca dose, and that this will help boost the immune system that will help fight this pandemic.
Rwanda rolled out the first vaccination program on March 5, 2021, administering the first dose of Pfizer and AstraZeneca. The first dose of AstraZeneca was administered to 290,000 people. The second dose of 247,000 vaccines were given to Rwanda, including 117,000 that were donated by the government of France. Gabi Muvunyi for RTV.
Thank you very much, Gabi Muvunyi, for that report. And still on this vaccination program, this evening we're joined by Rwanda Biomedical Center Director General, Dr. Sabin Sanzimana. Sir, thank you very much for joining us tonight.
It's a pleasure. Thank you.
So regarding this vaccination program, how many people are set to receive the second doses of AstraZeneca?
Yeah, we're planning to give the second dose to everyone who received the first dose, which means that they received it at different times. We started on March 5th and takes over some days. Majority received it the first week. But now, as we start tomorrow at 7 in the morning, those who have already attained 8 weeks after the first dose are invited to any health facility for taking their second dose. We expect that by early next week, I will be able to cover most of the people who received the first dose, and thereafter I will be waiting for others, just a couple of others who, for some reasons, came in a bit late and are not yet at the 8 weeks, which is the minimum time for someone to get the second dose. So it's basically from 8 weeks to 12 weeks. So in general, most of the people who received the first dose of AstraZeneca have reached almost 9 to 10 weeks, so exactly in the middle. So we see by Tuesday next week, we're probably going to have reached a majority, almost everyone for second dose on AstraZeneca.
All right.
Yeah.
And so, except vaccinating people who have already received their first dose of AstraZeneca, how is the vaccination program all over the country standing as of today?
Yeah, I think today we've deployed the vaccines from the central warehouse here in Kigali to all districts. Then the same this afternoon, all health centers pick their vaccines from district hospitals. So now, as we speak, all health centers have already their vaccines at the health center, and the people who are coming for second dose tomorrow morning will be getting their second dose at their health facilities. It doesn't mean that if you have traveled from the place you received the first dose, you have to go back to the exact same health facility. If, for example, you received the first dose in Rubavu, and today you are in Kigali, you don't need to go back in Rwanda to take your second dose, because our system is centralized. So wherever you go in a health facility, health center, or hospital, your data, your names and ID or code that actually been sent by SMS will be entered in the system. So you'll be able to get your second dose without moving around to find your initial facility. So this helps to get people accessing their vaccines without having to move around, but also it helps to give the vaccines faster because all the 500 health facilities will be offering the vaccine at the same time. So we don't expect crowds of people coming to one facility or a few. If you come in one health center and it's too many people, you can move to the next one. All those options are accepted, just in the framework of giving the vaccine as fast as possible and as convenient as possible.
And so, still on this program of the vaccination, in general, how can we say the program stands as the country intends to vaccinate at least 60% of the population by 2022? How is the vaccination program generally standing in the country?
We still have a long way to go. We've already covered 5% of the people who have to vaccinate. So if you think about the number of people on waiting to get vaccines, but it's not going to happen in one day. It's a plan that is taking us up to next year. The faster we get more doses of vaccines, the better we can attain 66% or 60% of the people that we've set as a threshold to say if we vaccinate 60%, we'll be able to cut the ways of transmission from one person to the other. But as of now, at 5% of people only covered, you can't say that the current measures of wearing masks or social distance, even hand washing, we are going to be changed because we still have a very few number of people vaccinated.
All right.
Some countries that are expanding their programs to reach that number. So we're also doing the same. Unfortunately, vaccines, the doses are not available as we wish, but our government is doing all the possible options to get vaccines as soon as possible so that we can go back to our normal life, which is possible if we continue to keep the current discipline and measures ourselves, individual protections until we get to that level. So there's a hope, but we have to stick on what we have achieved, protect our gains. So when we reach 60% or more, we can be able to enjoy some other ways we had before COVID-19.
All right, so back to these people, the program of vaccinating people who had already received their first dose. Some were worried that it's been way long since they received their first dose of AstraZeneca, and now that they're going to receive the second one, it might not be as efficient as it could be compared to the way they could have received it a bit earlier. What do you have to say about that?
That is not true. Actually, this timing we're giving this second dose, it's far better than having anticipated giving a second dose after 1 month or after a few weeks. Because the facts, the evidence we have is that during the previous trials of AstraZeneca vaccine, it was shown that after 28 days, the protection that it provides can be around 77%. But later on, continuous studies have shown that if you can wait up to 12 weeks, between 8 and 12 weeks, the protection or the efficacy of the vaccine is increasing from 77% to 85%. So that's why we, even in our guidelines, in World Health Organization as well, the minimum we can take the second dose for AstraZeneca was set at 8 weeks. And now we're talking about giving the second dose after 9, 10 weeks for majority of people vaccinated. So it's at the right timing, between 8 and 12. We expect the people who are going to get the second dose to increase their response to that level, which is actually the optimal. So it's good. It's a good timing.
All right. So, and finally, yes, the number of COVID-19 infections in the country have reduced with time, and I can say the country is progressing in terms of fighting COVID-19. But generally, how can we say Rwanda stands, and where does the country stand today in terms of fighting the pandemic, and what are your recommendations to all the citizens of the country?
Yeah, the COVID keeps changing for sure, but the current status or the trend of this pandemic in Rwanda is, I would say, and interesting levels if you look at where we came from. Generally, we have 3 levels of assessing the trend of this pandemic. There's a low, moderate, and high levels. So we've spent almost 1 month in low level of transmission with an incidence that is not going up to 1%. Actually, in Kigali is 0.5%. There's a time Kigali was up to 8%, even 10%. Early January, December last year, beginning of this year. So today we see a good trend. If we can keep it until we vaccinate more people, that will be a perfect way of containing and controlling this pandemic. But there are some districts that we're seeing now have seen increase and the set of cases, such as Karongi district, in the past 3 weeks. We see Gicumbi as well. So those 2 districts are getting better as well. So we have new data that they have improved, even the measures that the government took recently. But the thing with COVID, you can't say that this is a situation that will be tomorrow. So it keeps changing and changing. The changes happens with our behaviors. If I don't take and use my mask and I move around, and we are many like me who are doing the same, then the result will not wait. You will see the impact, negative or positive, out there. You remember in December, for example, the Christmas parties, the weddings in November, the behaviors that we as people were having just translated into the increase in death that we've seen beginning this year. So as we enter into the summer time, we need to be very careful, especially this is the time when people organize more parties, weddings, different ways of enjoying their lives. In one way, it's good for human beings, but in another way, you need to think very carefully if the party you're talking about or the wedding you're organizing and bringing people together, then your guests will become patients and get COVID next days. It's not something we would really want to happen again to us. So it's a message that I will pass on to say June, July is generally a time where people tend to do those kind of events. So we have to be careful so that our gains are not lost in just this summertime.
Thank you very much for your time, sir.
Thank you too.
Moving ahead to environmental matters now, according to the Rwanda Environmental Management Authority, a study conducted has found that no contaminated air in the western region, particularly in Ruvu district, resulting from the recent Nyiragongo volcano eruption, as JD Umwali reports.
The Ministry of Environment notes that the eruption of the volcano was a natural disaster and that it has affected things and people. The Minister of Environment says the Nyiragongo volcano eruption in the Democratic Republic of Congo, near the town of Rubavu, has had a serious impact. There are many consequences to this. If you don't see them, you will hear them. Both Rwandese and Congolese have been affected by this, as well as the land and animals. Firstly, people have had to flee their homes. We are accepting Congolese into the country where they are burning firewood because it is urgent. Another thing is the quality of air people are breathing in Kigali and Rubavu. It is extremely different. The Rwanda Environment Management Authority says it has conducted an air quality study on residents. They found that the quality of air ingested by some of the residents contained dust particles, but that there was no reason for alarm. We continued to hear that there was a strange odor in Rubavu, so we sent experts and equipment to take measurements to see if the gas was harmful when someone inhaled it. In the air, we found that the gas levels were at a normal rate, except for the dust every 5 minutes. They measured it and found it to be above the normal rate. Director General of Rwanda Environment Management Authority, Juliet Kabera, says that those in the area should be vigilant and take care but not become overly concerned about the situation. The important thing is that the public does not be alarmed, because we are confident that it will reduce. We are already wearing masks and we will continue to ourselves. We are monitoring the situation closely. Every time there is a change, we will tell the people how to adjust accordingly. The Nyiragongo volcano erupted on Saturday last week, and after its eruption, several earthquakes followed, resulting in some fleeing out of the fear that it would erupt again. Umngari Jade, RTV News.
Thank you very much, Jed, for that report. Moving ahead, on Thursday, the Gasabo District Administration, in collaboration with the Rotary Club, inaugurated a new building that will accommodate people with chronic illness who go to various hospitals in Kigali without accommodation. The renovated building is valued at more than 50 million Rwandan francs and has the capacity to accommodate 25 patients. The district executive administrator of Gasabo, Mwali Pauline, has noted that the building will benefit patients who travel from far. On the other hand as well, the head of Rotary Club Kigali Virunga, Juala Vijay Kumar, says the construction of the building was carried out in collaboration with other partners.
The most pressing issue was to complete the structure, and that has now been done. Now we must sit with the hospital's administrators and other stakeholders to access the equipment it needs so that patients can be cared for in it.
We fundraised from many organizations in Rwanda and international organizations in Germany, US and other places to be able to fund this project. So the project will be able to house 25 patients to get, when they are getting treatment, they can stay here.
Moving ahead, Vivo Energy Rwanda has launched a campaign to enhance its performance and service delivery. Customers can go to any engine fuel station where they will be given high quality and efficient fuel. According to the managing director of Vivo Energy Rwanda, Saibu Kulibali, the 6-week campaign will feature an exploration of Engine's customer service over a 3-week period. The next 3 weeks, customers going to Engine's fuel station will receive rewards.
To all of our customers, to all of our motorists, to all of our clients, this campaign is definitely a campaign to provide to each customer that is visiting each station the right quality, the right quantity and the right service at each station of engine in Rwanda. Coming to the quality of the product, we have to ensure that the quality of the product we are loading from the depots is the same quality of the product we are serving to our customer. So, in our quality insurance process, we are promising and we are putting in place all the elements in place in order to ensure that the quality of the product is keeping at the same level from the depot through the transportation to the service station. The customer that is visiting our service station will have opportunity to share with us any positive feedback in terms of customer experience or any feedback to improve also his customer experience through our service station. This is the main mission of this platform, Voice That Counts.
On behalf of the entire news and technical team that made it happen, thank you very much for being with us on RTV News. My name is Sam Kalisa. Have a good evening and enjoy your weekend.